This is Rod Rourke. Welcome back to Rourke Knows Podcast, helping you become a better you. Well, I can't think of a better individual to have on today to talk about rejuvenation and pre-rejuvenation than Dr. Foad Nahai, who is truly an amazing plastic surgeon, a legend, but also an incredibly good close friend of mine. He's an adjunct professor of plastic surgery at Emory. I mean, a world-renowned plastic surgeon, editor emeritus of Aesthetic Surgery Journal, and so much more. I don't want to waste time talking about it. I just want to say, Foad, thanks for taking time out of your busy day. I know you just got out of the operating room, so welcome.
Thank you very much. It's good to be with you. And you and I go back a very, very long time. And you're right, we've been long-time best friends. So it's good to see you and looking forward to this chat.
Yeah, it's gonna be great. I remember we used to do a snow ski meeting, which was awesome. And
exactly.
It was phenomenal. Another time. So let's talk about prejuvenation. It's a hot topic. So Foad, tell us, what is prejuvenation and what do you make of it?
Well, I think it takes its origin from social media, frankly. Young people looking at all the posts about the various anti-aging treatments and the rejuvenation treatments. So the term prejuvenation basically means preventing aging changes of the face. I don't like to call it anti-aging because anti-aging, it includes the entire body. So this came out of young people wanting to know, am I a candidate for injectables? Am I a candidate for fillers? Am I a candidate for these energy devices? So the term was coined prejuvenation, basically meaning before you need the rejuvenation, you're taking preventive measures.
Right. You know, like Botox, we're putting Botox in so you don't get a wrinkle in the glabellar area. I mean, what do you think of that?
I think it's a very effective prevention. And, as I grew in age, my patient population has as well. But I do see younger people, and of course, socially, when people know you're a plastic surgeon or find out you're a plastic surgeon, they come and say, am I a candidate for this? So I think it's very effective in eliminating those lines. And the advice that I give patients who come in to see me is that, the best time to start is before those wrinkles become permanent, before those lines become etched on the forehead, before this becomes etched and deep. So there is science behind it. There is no question that Botox works. There's no question that it can prevent those lines from becoming etched and permanent.
So what age would that be? So if my daughter, who's 22, says, Dad, I need you to do Botox, should I do it? She hasn't asked me yet, but.
Well, I would have her frown. If she frowns and you see those two lines, and let's say she comes to see me and she has those two lines there, I would tell her that this is the time to start, because as time goes by, those lines can become permanent. The muscles that cause the lines will become stronger. So basically, if I see a patient and I have them animate their forehead and I don't see any lines, I tell them it's a little too early for you. But the minute I see a line there, then I would recommend let's call it prejuvenation.
Yeah, no, I agree, and I've sometimes seen it in my patients that come for lip filler, and then they say, "Well, what about Botox?" And they can't make a frown, and going, "Well, I think it's probably a little early, or you can do a little microtox, but you really shouldn't do it." But prejuvenation is also things like great skincare, right? Retinol,
absolutely,
sunscreen,
yes,
sun avoidance. I mean, that's probably the best thing, and then stress avoidance and adequate sleep and stuff. But I think that's a good approach for neuromodulators, because you're right. Once you've got the deep frown lines, you know, it's hard to get rid of them. Then you have to add fillers.
Exactly.
So
you have to do more than just inject. I've been around in practice for over 4 decades. I remember when patients would come to see me that want a facelift and they really weren't ready. We had nothing to offer them other than good advice. Don't smoke, don't expose yourself to the sun,
Right.
Lead a healthy life, exercise, and as you mentioned, get plenty of sleep.
Right, I know, but today we've got that whole array of skincare. You know, the retinols, the antioxidants, and all these things. And what about the energy devices? Do you recommend that somebody who's interested in prejuvenation gets some energy devices? Let's just say they're saying, I want to prevent some jowling. What do you say to that?
Well, as a surgeon, as someone who's operated on faces that have had energy devices, it makes life difficult. The tissue planes are difficult to define, difficult
Right.
to inject. So I do tell them, and in fact, I just gave a cousin of mine that advice. She lives in Europe, and she said, "What do you think about this?" I said, "As a surgeon, I will tell you it'll make my life difficult if I ever do a facelift on you, but it is effective. It'll buy you some time before you need surgery, but just understand that you'll have to find a very experienced, qualified surgeon who's aware of the changes that these energy devices make to the subcutaneous tissues, to the tissues deep to the skin."
Right. And as you know, today it is rare to operate on a face today that hasn't had energy devices, some type of filler, some type of biostimulator. I mean, it's just to find a virgin face is pretty uncommon, at least in Dallas. How about in Atlanta?
Well, it's, I would say, Rod, it probably has to do with the maturity of your practice and my practice. Today's facelift, this was her 3rd one. Tomorrow, it'll be her 2nd one. And I didn't do the 1st or 2nd on either of them. So I do allow extra time. I do tell our trainees that, to me, the difficult facelift is the thin face, the heavy face, the male face, anyone who's had energy devices, and anyone who's had threads or some of the more permanent fillers.
Well, that sounds like almost every face.
You're right.
Facial rejuvenation is challenging. So what take-home points do you have, Fuad, for patients that want prejuvenation? I mean, what advice can you tell them, like your top 3 things?
The advice I would give them is to go to somebody who's reputable, who will assess your face and provide you with good advice, be it injectables like Botox or fillers like Juvederm or Restylane. And then if that person has an esthetician, I usually refer them to our esthetician, and on the referral form, I put down skincare. The esthetician thoroughly examines the skin and puts them on a skincare regime. As long as they're not at childbearing age, any patient who sees me for facial rejuvenation or prejuvenation, I do recommend Retin-A, and I use the line, if I never see you again, just go away with this one recommendation, that beyond lifestyle things that help keep you younger, use the Retin-A, use moisturizers, avoid the sun.
Great. Great advice from a great surgeon and a very wise one. Okay? Prejuvenation. It may help you, but depends on the time in your life you want to be prejuvenated. So give us your thoughts, give us your comments on this incredible advice you received today from Dr. Nahai and helping you become a better you. Till next time.